Fibro Osseous lesions of the jawbone. Fibro Osseous lesions of the jawbone, that means this will be seen. So it won't be a much more pathology. Here what you'll see, it will be seen in always 3 stages. So the number 1 stage, the normal bone will be resorbed. Okay, normal bone will resorb, it will be replaced by the fibrous tissue. And again, it will be replaced by the bony, or it will always, again, it will be matured to a normal bone after the few years. So sometimes, many times it doesn't need a treatment. By the puberty, it will be seen always in a younger one, and by the puberty, it will come to a normal one. If it is a larger size and causing some disfigurement of the face, then it will be needed the treatment in the form of a vengeance. So, depend upon in which stage the patient has come to you, the radiological or the clinical picture will be seen. It is more common in the females, it is more common in the maxilla, it is more common in the canine anterior region. Patient is totally asymptomatic, nothing pain is will be there, or no pain is there. Sometimes if it is in a younger age happens, it may sometimes will cause obstruction to the eruption of the tooth. So sometimes for that, for orthodontic purpose, you take the radiograph, you will see sometimes the lesion. Otherwise, it won't be causing any pain to the patient, disfigure to the patient. Extraoral swelling or intraoral swelling, larger size when it will occur, then the patient comes to you. You examine the patient, like you see, what you see is the intraoral swelling on the buccal side. You see there is no signs of the inflammation, the normal mucosa is seen, though no calculus, nothing drifting of the tooth, nothing, no symptoms will be seen, and when you palpate it, it will be seen as a bony hard swelling. Okay, bony hard swelling, and then when you take the radiograph, you'll see this is the disfigurement of the face. What you'll see is only the patient's complaint. Otherwise, nothing will be having a patient's complaint. Fibrous dysplasia, it is 2 types, as you know. This is called as the monostotic and the polystotic. Monostotic is involving the one bone only, and the polystotic may be involving the multiple bone. Polystotic, along with the involvement of the bone, it will always have a skin lesions in the form of a pigmentation that we call as a cafe or spots. So this will be a tiny or small pigments which will be brown color pigments which will be seen more on the trunk or more on the limbs and maybe rarely on the facial region. So this we call it as Albright syndrome or the Magnum syndrome. This will be always called as the cafe or spot. Along with that, what you see in the polystotic is the endocrine involvement. In the endocrine involvement, maybe in the diabetes, it may be a hypo, it may be hyperparathyroidism, or sometimes the pituitary diseases also can be seen. There may be a precocious puberty also, which will be seen in the polystotic diseases or polystotic fibrous dysplasia. Depend upon, as I told you, when you take the radiograph, at what stage you take the radiograph, you will see the radiological picture. Okay, when you take in the initial stages, that is when the bone is replaced by the soft tissue, what you will see is only a radiolucent lesion. And when you see when the soft tissue or that fibrous tissue is replaced by again the bone, then we will see a multiple radiographic features which you see. It may be that means in the differential diagnosis you have to give mixed lesions also. Like you have seen in the COT, same type of the picture also can be seen when the fibrous tissue is replaced by the bone. And when it is completely formed, the bone which is there, it may be not a completely a normal bone. So that means it may be seen in the different forms, a granular form. So that granular form, sometimes we label it as a ground glass appearance. Sometimes it will be an orange peeled appearance, sometimes it will be an onion skin type of the appearance. To see this ground glass appearance, definitely you have to proceed for an IOPA radiograph. In that only will be seen. And then with this new bone formation, in the different way, it also will be seen as a cotton wool type of the appearance. What you see, if it is what is the involved region, there will be a generalized loss of lamina dura. So in the various questions you must be doing, or in the objective type of the questions, always ask what are the causes for a generalized loss of lamina dura. Here also you can see a generalized loss of the lamina dura will not be seen. So you will see a ground glass, you will see orange peel type of appearance, you will see a ground glass type of the appearance. You see, and if it is towards the posterior side, sometimes it may be causing a displacement of the nerve canal also. Okay, you'll see here the nerve canal also has been displaced also. It won't be causing the features associated with the nerve only, but they will be lifted one. There won't be any paresthesia as such in the lesion. And lastly, the Paget disease, which is there. This is bone deformity where the bone will be resorbed and again it will be formed, but that is abnormally. So that means abnormally there is a resorption of the bone and abnormally the bone formation is there. So no uniform or the pattern which you see in the fibrous dysplasia. So this is more commonly will be seen in the leg bones and all this. So the bone will be more weaker. So because of this bone weaker, so there will be always a bone deformity. The bowing of the bone, the patient's stature will be different one. For the our oral cavity or the maxillofacial region, the maxillary sinus will be more commonly will be affected. There will be a drifting of the teeth which is there and the patient is wearing a denture because the most of the time it will be seen in older age and then the denture also will become loose or there will not be a fitting of the dentures also will be seen in these cases. Otherwise it will be causing more in the longer bones, the Paget disease. Like this you will see, and if you take the radiograph, what you will see is always a cotton wool type of the appearance which will be in the adenogenous arches. This is a typical cotton wool type of the appearance which you will see in a Paget disease. These are at least, as I told you, remember the appearance and the disease. So which radiographic appearance is seen in which disease, that either in the viva or in your objective type of the questions or in your spotters. One questions will be always there in these appearances on the radiographic appearances. So this please keep in mind. So this is your Paget disease, and along with that, one more picture what you see in the Paget disease is the hypercementosis. Okay, you'll see this is the hypercementosis which will be seen. See this hypercementosis. You see in this radiograph also, you will see the hypercementosis along with the cotton wool appearance or the new bone formation which will be seen.